Good morning. I'm Bob Sanborn, President and CEO of Children at Risk. We're a statewide group focusing on research and advocacy, making sure that every child in the state of Texas, and certainly every child in the San Antonio area, is able to be successful. And today we're talking about a brand new report that we've done focusing on sleep. So in partnership with Mattress Firm, we're focusing on sleep insecurity here in the San Antonio area and across the state of Texas. And the idea is that we understand when kids don't get good sleep, they're not likely to be successful. There's going to be a whole host of problems that they will face as they strive for that success that we want for every single child in the state of Texas, and certainly for every single child in the city and area of San Antonio. We have a cast of characters that you're going to love that we're going to talk with today around this issue of sleep insecurity in San Antonio. First off, Sharon Jones is with us. She's the Chief Equity Officer for Children at Risk and the Director of the Texas Racial Equity Collaborative. Carmen Vincent is with us. She's with Mattress Firm. Carmen, nice to see you. Thanks for being here. We enjoy the partnership. Sharmali Roy is with us. She's the Director of the Center for Social Measurement and Evaluation. Thank you for being here, Sharmali. Katie White from Family Service. She's the VP out there, and she's going to give us a view on the ground what's happening in San Antonio in relation to the issue we're talking about today. And Guadalupe Fernandez is with us. She's the Director of the Children's Immigration Network, and she and I will be having a conversation in Español para la prensa latina, so we'll be able to do that in Spanish for Univision Telemundo and the like. First off, what's really interesting for us in this study is that we're seeing something that all of us basically knew, right? Our mom used to say, get that sleep, it's important for your success. And we knew she was right, but we didn't always listen to her. And in a sense, that's what's happening here in Texas. We know that it's right that we're not getting enough sleep, and certainly that our kids are not getting enough sleep, but we're not always listening. We're not always following the good advice that mom used to give us. As we look at sleep insecurity across the state of Texas, we understand that there are certain areas, and we have certain maps that we've developed that focus on this sleep insecurity, that focus on neighborhoods that are having a very hard time with kids getting the sleep that they need to be successful. And we know that when kids don't get that sleep, they're not going to be academically successful, and they're going to be open to a whole range of health challenges as they move forward. And so we want to understand this a little bit more in Texas. We want policymakers to be able to make good decisions based upon this, and we want parents to be able to help in the success of their children. When we look at the research, it's very clear that sleep is important. Children who don't get enough sleep are much more likely to have health problems like obesity, mental health problems. They're much more likely to engage in risky behavior. And we also know that at pediatric offices, studies are showing that pediatricians aren't asking enough about sleep patterns. They're not asking enough about sleep insecurity and helping families with this idea of sleep. When we look at public policy, things like daylight savings time, daylight standard time, we know that those time disruptions are very tough for children. We also know things like school start times can be very tough depending upon the age of the child. But most importantly, we understand that all of these policy pieces that focus on the alleviation of childhood poverty are very important when it comes to making sure that kids get good sleep and are very successful. So this is something that we're going to talk a little bit about today as well. Our study looked at 11 different variables in the state of Texas. We looked at family and child poverty. We looked at shift work of the parents. We looked at crowding in the homes, what's happening with crowding, the mobility rate of our students in the state of Texas, student homelessness. And then in regards to health factors, we looked at childhood obesity, mental health, food insecurity and hunger, the disabled child population, and the kids that are in the workforce that are working. What we know is that when kids don't sleep well, that it dampens their future. And if we want the future to be bright for young Texans, we're going to have to do more in the area of sleep. So what can parents do? We know that parents are sort of this first line of defense. They're the first responders in the lives of our children. We have significant recommendations based upon the research that we want parents to be able to follow. One is setting a regular bedtime. This is a very simple thing, but if parents are able to set a routine and a regular bedtime, we're going to see significant increase in sleep security. We also know that the idea of a parent giver reading a book each and every night to a child as they go to sleep, or singing a song, being active with them, even if it's the same book every evening. This is a activity that really helps children in regards to sleep, and certainly the literacy byproduct is fantastic. Taking a walk together early in the evening, later in the afternoon, it's just part of this idea, solidifying this idea that activity is a good thing and will help with sleep patterns. Eating dinner together, we know, is a time-proven thing. Research shows that if families eat dinner together, they're not always able to do that, but when they can, we see a significant improvement in sleep and other patterns in life. Keeping the room cool, very important. Shunning screens, like making sure that children are not bringing in their smartphones or tablets into the room with them, an important thing. And then with babies, with very young kids, follow that pediatric advice of how the kids should be sleeping. And it's really important to focus on that safety. When we look at policy changes, I've talked about the alleviation of poverty, things like the child tax credit. We should be considering this much more seriously than we're considering it right now, because this will have a vast improvement for our children. Things like food insecurity and some of the legislation around that. The easy ones are things like eliminating this changing of times. And we talked to school official after school official that talks about the differences in kids when they come back after daylight savings changes. And so we need to make sure that if we could, let's just have one time the whole time through, and we're going to see better kids, more success in regards to kids as we move forward. Here in San Antonio, Bexar County, one of the things that we saw is that there are 32,000 kids, over 32,000 kids in Bexar County that are living in these zip codes that are basically sleep deserts. They are not very likely to be sleeping well because of a number of these factors that we've talked about. And so we want to try to eliminate these sleep deserts here in Bexar County. When we looked at certain zip codes and certain neighborhoods, and we saw two schools that sort of stood out for us, Marshall Academy and San Antonio ISD, Sarah King Elementary, San Antonio ISD. These were schools that are sort of smack in the middle of these zip codes that are sleep insecure. And we use the examples of these schools, that these are red flags. These have levels of mobility that are very high, 31 and 24% respectively for these two schools. And policymakers should be looking at, the school leaders should be looking and saying, what are we going to do differently in these schools to make sure they're successful? Because they're in the middle of these deserts. So there's a lot for us to do as we consider this. And for me, one of the important things is that this is a new lens for us to be able to look at childhood success. And we look at a lot of things. We look at childcare deserts. We look at food deserts. This is another way of saying, this is another component for child success, is to look at how they're sleeping. And in many ways, it comes back to poverty, but it's something that we love this idea that here are steps that parents can be part of to really make sure that our children are successful. Aaron, one of the things that you focused on is, I've been talking a lot about sleep insecurity, but Sharon Jones, you've looked a lot at the sleep inequity as a part of this.
Absolutely, Dr. Bob, and thanks. And we're so grateful to Mattress Firm for this opportunity to talk about sleep as a basic need and as a human right, and under this racial equity lens as well. We know that where a child lives decides how well they sleep, according to our studies. Without support for parents, families, and schools, kids aren't able to develop equally, and kids in Texas aren't able to develop equitably. So we're looking at neighborhood factors such as light, noise pollution, crime, and an overall sense of safety. In addition, we're looking at access to green spaces and grocery stores for adequate exercise and adequate nutrition. And then we also want to look back at policies that create segregation due to biased redlining and other policies that manifest itself today in sleep disparities. Factors such as socioeconomic status, race, ethnicity, education, family size and structure, all these things increase the likelihood of sleep insecurity. And children with some of these factors are more likely to be sleep insecure and have been found to experience less of that deep, slow wave sleep that's associated with good memory and learning. So we estimate equity by the difference, the size of the chasm between those who have adequate sleep and those who do not. And so even in areas where there are greater amounts of sleep security, we find that those disparities are greater between those who have it and those who don't. And so using our sleep index variable, we look at low socioeconomic status, sleep environment, such as the mobility rate you discussed and homelessness rates, individual level factors such as obesity and mental health, and whether or not a family is receiving SNAP assistance, whether or not there's someone in the family who's disabled, or if there are kids in the family who are actually a part of the workforce. So all of these things make up the level of equity that we look at when it comes to sleep in Texas for children and families.
Thank you, Sharon, very much. Let's see, Carmen Vincent. I love this idea that we're doing a press conference and Carmen is in the store working. There's Carmen. Carmen, I just want to commend you. You're working and doing a press conference, something that I could never do. So no, that's okay, Carmen. Tell us a little bit from your perspective, because we're so proud of this partnership with Mattress Firm, but from the Mattress Firm perspective, and you as a store manager there in San Antonio, talk about the importance of this partnership and what you guys are looking forward to with the study.
Sure. So at Mattress Firm, we believe all families deserve a safe and comfortable place to rest their heads. Now, ultimately, we know that the right mattress is the foundation of quality rest, but there are so many factors that can also help control the sleep quality. Those that might be out of a parent's immediate control, from poverty to hunger or shift work that adds barriers, to implementing a healthy bedtime practices that are critical for child's long-term health and development. So it's a basic need that every child deserves to have met and every parent wants to be able to provide as well. So for those reasons, Mattress Firm is proud to partner with the Children at Risk on this project. Children at Risk is also known for focusing and fulfilling those holistic needs for children and examining their intersectionality of issues affecting child well-being. The data presented today confirms much of what we already suspected. Our children do not have equitable access to sleep. Socioeconomic statuses like their race, their ethnicity, or the street that they live on can have undue influence over their quality and quantity of sleep, which we also know that sleep can be a solution. So by addressing these root needs, addressing these root needs.
That's okay. Hey, Carmen, let me ask you, I know that you're in a store. Where is your store in San Antonio that you're working out of?
We are working out of 281 in Bitters. I have so many people in here, a lot going on. I'm so sorry.
Listen, you know, I just want to thank Carmen. I'm going to let you get back to your customers, and you guys call them guests.
I apologize, you guys.
No, that's okay. But I just appreciate that Mattress Firm has been engaged with us, and Carmen, that you're here for us. And I think it's exciting that you're there in the store. Get back to your guests, but thank you very much for this partnership.
Thank you, guys. I'm so proud to be a part of this today. You guys have a blessed day.
All right, take care. Bye-bye. Sharmali, from your perspective, you're the lead researcher on this and the director of the Center for Social Measurement and Evaluation. What was the thing that was sort of most surprising or maybe most alarming that came out of this for you?
So, I mean, I would just say that, grateful for the opportunity to partner with Mattress Firm, because I think, again, like the importance of sleep. Now we can, whatever our findings are, we can disseminate more quickly, like at the store, let's have a handout for parents to take with that mattress that they're buying, that's a busy store over there. So our findings, hopefully recommendations can go home with them, as you mentioned in the beginning of, the hour where things that parents can do at home. But like in terms of your question, in terms of what was the most, important finding, was just the importance of sleep to development, understanding that everything from in utero, the, pregnant person's sleep, the woman's sleep in terms of how stress hormones, cortisol affects in utero, the baby's development, to birth, infants who need about 17 hours of sleep. That I think I was surprised. I don't have a child, obviously, but even understand that I don't know if all of the children and the age groups are getting sleep in age appropriate ways. Even teenagers need up to 10 hours of sleep. I don't know if they're really getting that. So understand the developmental needs and how that affects and deficit from that. Even an hour less sleep adds up in terms of developmentally, mental health, physiological development. So it was just very eye-opening in terms of thinking about it as a basic need. Mom tells you to go to sleep, but you're still up, but then really you are hurting yourself or things are not working towards you when with such big impacts.
Yeah, very good. And for purposes of press, the report is available, right? We're putting it in the chat box for the press, and we're happy to send that out. I want to get it from the ground, though, from Katie. You're with Family Service, and you're vice president out there, and you guys see this sort of stuff in action. You're dealing with families and children day in and day out. For you, what's the impact of this? And talk about your work and the intersection of sort of this study and others like it and the work that you guys do.
Of course, and I'm so grateful to be here. Thank you to Mattress Firm and Children at Risk and everyone who's spoken on here so far. It's, these are all resonate with what we know and what we see every day. And, the reality is our families are struggling more so in the past 2 years than ever before. It's all compiling, right? It all is magnified based on everything else that's happening, right? So the work of Family Service, we work through the social determinants of health framework, which and through a trauma-informed care lens. And of course, social determinants of health are factors in our lives that determine where we're born into, where we live, where we work, where we play, and where we age, right? So everything that Sharon was saying about inequities and racial disparities and everything Charmalee was saying about, making sure that we have enough sleep and, for babies in utero, and then of course, teenagers and all of that. And Dr. Sanborn, what you were saying about bed hygiene, like all of these things fit in within that framework, because we know that in order to have dinner with your family, in order to maintain a kind of sleep hygiene, in order to make sure that you have the resources you need to be stable, you have to have so many stabilizing factors, and our families don't have that. So our work initially is just to work to reduce the number of challenges that our families are facing and lower the stress level in their lives, right? To make sure that they are able to go home and have dinner together as a family, which is a huge part of family stability, right? Their kids are able to make sure that they're able to sleep, maybe if not in their own bed, at least within a bed that's appropriate for their age, right? All of these things that impact the way we're able to function in society, and especially for children. Sleep is a precursor to being able to build resiliency and have core memories and all these other things that we know are so important to children becoming successful adults, right? And those children, so right now with children, but their parents were once children and they experience this as well. So we're dealing with multi-generational poverty and stress and all these adverse childhood experiences that are kind of just all just cascading and surrounding these families. So in order to be able to do that, we have to address so many basic needs, and there are so many, and you can't do that with just a singular approach, right? It has to be integrated. It's economic stability and neighborhood support and workforce development and childcare and education and all these things that circle around one another to make sure that families can be truly successful in life, because we've removed the challenges that prevent them from being so. So all of this is so important. All of sleep is, when you talk about it as far as a hierarchy of what's the most important social determinants of health, they are all critically important to one another, because it all integrates together for the success of families. But we do that on the ground through direct service work. But I would be remiss to say that we also have to challenge our leaders who make public policy. They have to be the ones invested in our family success ultimately, because whatever is funded is what we can do. And that's just the reality of it.
When you think about your average resident of San Antonio, whether they live in the suburbs or Alamo Heights or wherever they might live, as they talk to the leaders here in San Antonio about this, and you hear that over 32,000 kids almost definitely live it's security. And you and I both know it's sort of the tip of the iceberg in terms of the number of kids that are growing up in low-income families. What should be the message that those families are giving to our leaders?
Well, they need more. They need more supports. It's to be able to say all you need is, and yes, it is a mattress, right? But it's not just a mattress. It's making sure that it's light exposure, right? It's making sure that they have stability within their job. So I believe it was Charmalee, you were talking about teenagers needing 10 plus hours of sleep. So as you're talking, I'm writing all these points down because they mesh together, right? And it's impossible to speak to one without speaking to all of them, right? So you're talking about teenagers that need 10 plus hours of sleep. Well, if you're going to school and then you also work a part-time job to support your family, and then on top of that, you have to do homework, how is that successful, right? But what we really should be doing is addressing this all together as educators, as parents, as policymakers, at advocacy groups, all of us working together on success of families, because right now our families need us. Texan families need us to support them and to uplift them and to remove challenges that prevent them from succeeding, because it's not them not trying. It's us putting challenges on them that prevent them from succeeding.
Katie White is with Family Service and the great work that you guys do, Katie. Thank you so much for all the wonderful things that are going on with Family Service. Algunas palabras para la prensa latina. Tenemos con nosotros Guadalupe Fernández. Guadalupe, ¿nos puede hablar un poco de qué estamos hablando hoy?
Sí, claro. Hoy estamos orgullosos de presentar nuestro estudio titulado Descanso y Resiliencia, donde exploramos la inseguridad del sueño en Texas y aquí en nuestra región de San Antonio. Mattress Firm apoya el buen dormir y estamos agradecidos por su colaboración en este reporte. La comida, la vivienda, la ropa y el sueño son necesidades básicas que todo niño merece tener cubiertas. Todos los padres quieren satisfacer esas necesidades básicas y entienden la conexión. Así como mamá nos contaba, dormir es importante para nuestro bienestar. El estudio nos muestra un número significativo de niños en nuestra región y en Texas que no duermen bien. Y sabemos que la falta de dormir perjudica el desarrollo, la salud y el bienestar de nuestros niños y de nuestras familias y el éxito de nuestra región. La desigualdad y disparidad del sueño en el estado y en nuestra región es muy alarmante, así como lo damos en el reporte. El reporte también destaca recomendaciones para asegurar el bienestar de los niños a través del sueño, recomendaciones para padres para asegurar que nuestros hijos puedan dormir, así como establecer un horario regular para dormir, hacer ejercicio, cenar juntos y sanos como familia, asegurar que el ambiente esté fresco para mejor comodidad mientras duermamos y controlar el tiempo que nuestros pequeños usan pantallas y tecnología y en vez que nos pongamos a leer juntos como familia para que podamos descansar los ojos antes de dormir. Igualmente, destaca recomendaciones de pólizas para apoyar a padres de familias en asegurar el buen dormir de nuestros hijos, así como pólizas que alivian la pobreza en nuestra región que directamente contribuye a la desigualdad del sueño y seguir apoyando los recursos que existen en nuestra comunidad, así como Family Service, que apoyan a nuestras familias con las necesidades básicas que todos niños merecen, y pólizas que eliminan las barreras para que nuestras familias puedan acceder a las necesidades básicas. Igualmente, los quiero invitar a nuestro evento mañana titulado Una oportunidad de luchar, necesidades básicas y éxito infantil, donde vamos a explorar los desafíos que enfrentan las familias de hoy para satisfacer las necesidades básicas de nuestros hijos, desde el acceso a alimentos, vivienda y el buen dormir. Hablaremos con expertos que atienden a nuestras familias, donde explorarán las soluciones que existen para satisfacer las necesidades de nuestros niños y aprenderemos qué podemos hacer todos para brindar que cada niño tenga la oportunidad de aprender, crecer y prosperar. Tendremos interpretación disponible durante el evento.
Gracias, Guadalupe. Muchísimas gracias. Sharon, Guadalupe talked about our big Basic Needs Summit that's going to be available virtually for all residents of San Antonio, anyone who wants to tune in. Talk a little bit about that, Sharon.
That's correct. So tomorrow at 10 a.m., you can go to childrenatrisk.org and register for free. It will also be in the chat here. But tomorrow at 10 a.m., we will present A Fighting Chance, a summit on basic needs, sleep, and success, where there'll be a deep dive into the report, including the maps that Dr. Bob talked about and details on where in Texas children need help sleeping better. And we'll also be talking with more experts to develop strategies for helping kids and families in Texas get a better night's sleep.
Very good, Sharon. Thank you very much. I certainly want to thank Carmen from Mattress Firm for being able to join us, and Mattress Firm overall for their support on this. Big. And Katie White, thank you so much for the work that Family Service is doing. I so appreciate you being part of this. Give our regards to your whole team because you guys do such great work. So,
well, it's wonderful to be here. And, I'm certainly just grateful for my colleagues and my program staff who tell me these things very honestly about what they're seeing, right? Because then we say, like, this isn't just our opinion, our expert opinion is our community's experience, right? And when we are able to portray that on platforms like this, things get done. And we're very grateful to be here and for all of the work that everyone's doing here.
Well, you guys are getting things done. That's right. So Sharon, Charmalee, Guadalupe, thank you guys very much. Everyone on the call, including Carmen, will be available for further interviews if any of you guys in the media would like to interview them. And we're able to send you any sort of this information that you might need as well. But thank you all very well. Sleep well. We'll talk to you guys soon. Take care. Thank you.
Yeah.